Mesothelioma. The name itself sounds ominous, doesn't it? It's a rare and aggressive cancer primarily affecting the lining of the lungs, known as the pleura. But it can also occur in the lining of the abdomen, heart, or testicles. This video will delve into the depth of mesothelioma, exploring its causes, symptoms, diagnosis, and treatment options. The primary culprit behind mesothelioma is asbestos exposure. Asbestos, a naturally occurring mineral once widely used in construction and various industries, is composed of microscopic fibers. When these fibers are inhaled or ingested, they can become lodged in the lining of the lungs or other organs. Over decades, these trapped fibers can trigger inflammation and genetic changes, ultimately leading to the development of mesothelioma. While asbestos is the most well-known cause, other factors like exposure to radiation and certain genetic predispositions may play a minor role, but these are far less common. So, what exactly happens inside the body when asbestos leads to mesothelioma? The asbestos fibers, lodged in the mesothelial cells, the cells lining the pleura, peritoneum, or other organs, cause chronic inflammation and irritation. This persistent inflammation triggers a cascade of cellular events, including DNA damage, uncontrolled cell growth, and the formation of tumors. These tumors then disrupt the normal function of the affected organ, causing a range of symptoms. The cancer spreads locally, invading surrounding tissues and organs. In advanced stages, it can metastasize to distant sites in the body. Mesothelioma is, thankfully, a relatively rare disease. The vast majority of cases are linked to occupational asbestos exposure, meaning it predominantly affects individuals who worked in industries like construction, shipbuilding, mining, insulation manufacturing, and other occupations involving the use or handling of asbestos. While asbestos use has been significantly restricted in many countries, the latency period between exposure and the development of mesothelioma can be decades, meaning cases are still being diagnosed today. Even in countries with strict asbestos regulations, the incidence rates vary geographically, with higher rates in areas where asbestos use was historically more prevalent. The symptoms of mesothelioma can be subtle and often mimic other, more common conditions, making early diagnosis challenging. Common symptoms of pleural mesothelioma, which affects the lining of the lungs, include shortness of breath, chest pain, a persistent cough, and unexplained weight loss. Fluid buildup around the lungs, known as pleural effusion, is also a frequent finding. Peritoneal mesothelioma, affecting the abdominal lining, may cause abdominal pain, swelling, nausea, vomiting, and changes in bowel habits. Because these symptoms are nonspecific, it's crucial to seek medical attention if you experience them, especially if you have a history of asbestos exposure. Diagnosing mesothelioma is a complex process that often involves a combination of imaging tests such as chest X-rays, CT scans, and MRI scans to visualize the tumor and assess its extent. A definitive diagnosis requires a biopsy, where a sample of tissue is taken from the affected area and examined under a microscope by a pathologist. The pathologist will look for specific cellular characteristics that are unique to mesothelioma. Immunohistochemical staining, a specialized technique, is often used to help confirm the diagnosis and differentiate mesothelioma from other types of cancer. Mesothelioma is classified into several types based on the cell type under the microscope, each with differing characteristics. The most common type is epithelioid mesothelioma, characterized by cells that are well-defined and relatively uniform. Sarcomatoid mesothelioma is a more aggressive type with spindle-shaped cells. Biphasic or mixed mesothelioma contains both epithelioid and sarcomatoid cells. The specific type of mesothelioma can influence the prognosis and treatment options. Treatment for mesothelioma is typically multimodal, involving a combination of surgery, chemotherapy, and radiation therapy. Surgery aims to remove as much of the tumor as possible, often involving the removal of the pleura, lung, and diaphragm in pleural mesothelioma. Chemotherapy uses drugs to kill cancer cells throughout the body. Radiation therapy uses high-energy beams to target and destroy cancer cells in a specific area. Immunotherapy, which harnesses the power of the immune system to fight cancer, is also emerging as a promising treatment option for some patients. The specific treatment plan depends on the stage of the cancer, the patient's overall health, and the type of mesothelioma. Palliative care, which focuses on relieving symptoms and improving quality of life, is an essential component of mesothelioma management. The most effective way to prevent mesothelioma is to avoid exposure to asbestos. This involves implementing strict regulations regarding asbestos use and handling in industries and construction. Proper safety measures, such as wearing protective gear and using adequate ventilation, are crucial for individuals who work with or around asbestos-containing materials. Asbestos abatement, the process of removing or encapsulating asbestos in buildings, is also important for reducing the risk of exposure. Public awareness campaigns can also educate individuals about the dangers of asbestos and promote safe practices. The prognosis for mesothelioma is generally poor, as it is an aggressive cancer that is often diagnosed at an advanced stage. However, advancements in treatment have improved outcomes for some patients. Factors that influence the prognosis include the stage of the cancer, the cell type, the patient's overall health, and the response to treatment. Researchers are actively investigating new therapies, including targeted therapies and immunotherapies, to improve the survival rates and quality of life for mesothelioma patients. Recent research has focused on identifying biomarkers that can help predict prognosis and response to treatment, as well as developing novel drug combinations that can overcome resistance to existing therapies. Clinical trials are ongoing to evaluate the effectiveness of these new approaches,